Hi, I'm Dr. Rachel Tate, coming from Philadelphia at ACR 2022, and I have the distinct pleasure of interviewing my new friend, Dr. Sinead Mcguire. Sinead, thank you so much for being here with us.
Oh,
This is
thank you for
awesome.
inviting me.
No, oh my gosh, I've been so excited to interview you since 2020 when we first met you with Dr.
Thanks.
Conway. So, my question to you is, you have this amazing abstract, 406.
Thank
Can you
you.
tell us a little bit about it and what inspired you?
Sure, of course. So I've been really interested in patient outcomes in women specifically with axial spondyloarthritis. So we know that the kind of epidemiology of ankylosing spondylitis and axSpA has changed as we've learned more about it over the past couple of decades. And so I've been trying to focus more on women with the disease to understand how they differ from men. And so what we did with this study is we used data from the Ankylosing Spondylitis Registry of Ireland, or the ASRI, and we did a correlation analysis essentially between BASDI, which is one of our really commonly used disease activity indices, and also the ASQOL, so looking at quality of life outcomes. And essentially we found that women, the correlation between these two indices is weaker in women than in men. So this is telling us that maybe the BASDI isn't reflecting the true impact of quality of life in women with axSpA, and kind of raises the question, maybe are there some more minute changes within the BASDI that are having a greater impact on women in terms of their quality of life outcomes? And it opens the door to a lot of interesting studies down the line, like do we need to change the cutoff indices for what disease activity is in BASDI for women with axSpA, or maybe do we need to consider developing a new tool to try and capture the impacts of their disease a little bit better? So that's what we were looking at, and so I think this study is kind of like opening the door to future studies. It's relatively simple in its analysis, but I think it does raise some really interesting questions.
Well, and you're not the only one to talk about this as disease state measures, and do they actually capture disease activity for AS, particularly in women, from pregnancy and non-pregnancy standpoints too. So you mentioned something interesting to me, which is this sets the stage for future development and for future, hopefully, clinical trials for us.
Absolutely.
I know you're not in Ireland anymore. We've gotten you over to this hemisphere. So tell me a little bit about the future. You are working with ASRI. Tell me about any registries this year.
Yeah, so I have been doing a lot of work with ASRI the past few years, and specifically looking at women and looking at pregnancy outcomes, which was really exciting. We actually published a paper last year on pregnancy outcomes from the ASRI, but I'm planning on building on that going forward, using data from the OHIP, which is the Canadian Insurance Registry in Canada. And so what we're planning to do is a much bigger study, essentially looking at pregnancy outcomes in women with AS. So we're hoping that will, again, draw a little bit more attention to this, also help inform our management of these women as they go through their pregnancies, because the problem with pregnancy information in women with rheumatic disease is that a lot of it is really on rheumatoid arthritis and it's on lupus, and our poor women with SPA, they want to know what to expect or what to look out for. So that's why we're doing these studies, to try and answer those questions, draw a bit more attention, and also set the stage for future studies.
I think you said that beautifully. Clearly, pregnancy is an area that I am really interested in too, as are you, not only in our spondy patients, but across the board, right? We need more information. And interestingly, you mentioned this earlier, but the BASDI was originally developed in the early 90s, and it doesn't capture potentially all of our patients. So this is a real area of unmet need. I'm so happy you could join us today. I'm so excited for your future. I can't wait to share it with you.
Thank you so much.
Of course. And we look forward to having you back again with us. But for any other comments or discussions, check us out on rheumnow.com. And of course, as always, follow me on Twitter @UpToTate, and follow Dr. Mcguire at
At Sinead M15. Thank you very much.
Thank you.